Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss few important questions from nervous system, and it is for your 2025 CPC exam. So far I have covered from 1 to 5 series of this CPT portion. I have covered all the important, not all the important, few important questions for your exam. Okay, so now today we are going to see the important questions from nervous system. Nervous system, the code range is 6 to 6, like 6000 series is for nervous system. Okay, so in the nervous system again you will be getting 6 marks question. So you should be knowing that in this nervous system it is again we will be having endocrine system also. Endocrine system will be getting 1 marks, and apart from endocrine, and like in the 6 series you will be also seeing the procedure related to eye and adnexa, and also ear related procedure. Okay, and apart from that, usual nervous system procedures are like neurostimulators and extracranial nerves or peripheral nerves procedures. Again, destruction by neurolytic agent, like other procedures like shunting method and SRS, like stereotactic surgery, radiosurgery, and chemodenervination. Okay, and there are 3 types of injections, right? So we will be seeing all those under nervous system. Okay, burr hole, twist drill hole, all those are very important concept for nervous system. So today the first question we got is, you can see the procedure. Patient was taken to the minor procedure room, where his left eye was prepped with the bethadine and wrapped with the usual fashion. So a lead speculum was placed in palpebral fissure. A small amount of 2% of lidocaine with epinephrine was injected with 30 gauge needle and subconjunctivally in superior temporal quadrant. 30 gauge needle was inserted into anterior chamber of eye, and 0.05 ml of aqueous is removed. Okay, so here you can see this is the procedure related to eye, and like in simple what you can see the procedure is aqueous is removed. So aqueous removal or drainage, it's like the fluid will be there. It's a clear fluid. Okay, it will help in maintaining the like high pressure. Okay, not high pressure, eye pressure. This will help to maintain the eye pressure. Okay, it will be like between what to say, lens and cornea, right? So if it is too high, that eye pressure is too high, they'll perform aqueous drainage or removal procedure. So in our question they have removed a 0.5 ml of aqueous removed. So this is the exact procedure they have did. So we'll see the answer for this. So also inserted into anterior chamber. This is also one important coding point here. So let's see the options. And LT modifier they have given because the procedure is happening on left eye. So you can see I'm directly going to anterior chamber. So for your benefit, for your better understanding, pause the screen, navigate with all the options and find out the correct answer. Okay. So anterior chamber, under anterior chamber, you should also look for aqueous removal. So you can see incision they did 65800 parasynthesis of anterior chamber of eye with removal of aqueous. Okay, so our first standalone code itself has this 65800. Okay, so 65800 option we have. Option A, 65800 with LT modifier will be the correct answer. Okay. Okay. So next question. So you can see here the evisceration of ocular content was performed using surgical microscope for enhanced visualization. The procedure was performed in the left eye and implant was not placed in the ocular cavity. Okay, so here the question is about, just a minute. My mom is making sound in kitchen. Okay. So you can see here the procedure is evisceration. So you should also have a, you should check what exactly, like what procedure they are performing. Okay. In this, oh, sorry guys. So coming back to the second question. So second question here, the procedure is about evisceration. So in this, they have, they performed they have utilized surgical microscope, and left eye and an implant was not placed in the ocular cavity. So definition you should be aware. Okay, so eye enucleation procedure and eye evisceration procedure, both procedures are different. Okay, so evisceration procedure means they'll be removing the internal content of the eye. Okay, few things they'll leave it there. But when it comes to enucleation, enucleation means entire structure they'll remove. So, but in our question, it is evisceration procedure. So, anyway, the keyword is clear. So, based on this, you can navigate and you will get the answer. So, 6, 5. You can see here. So here is there removal of eye. So under removal of eye, you can check evisceration procedure is there and enucleation procedure is there. Okay, so in our current question, it is about evisceration procedure. So you just have to check without implant or with implant. Okay, if implant they have introduced, you will code 65093. If there is no implant, then you will code 65091. So you can see evisceration and left eye and an implant was not placed. So you have to select without implant. So without implant code is 65091. 65091 says evisceration of ocular content without implant. And LT they are utilizing because it is the procedure is on left eye. Okay, and also if they are focusing on eyelid, okay, if any procedure they are performing on eyelid, then you should use E series modifier. Okay, E1, E2, E3, likewise you have to use. Just I'll show that also. See here, these modifier you have to use. You will check the eyelid, the exact location, upper eyelid or upper left eyelid, lower left eyelid, upper right eyelid, lower right eyelid. Likewise, you will check, and accordingly, wherever they are performing procedure, you will utilize that particular modifier with procedure. Okay. Since we are using LT, laterality modifier, because it is total eye, we are not only focusing on eyelid but eye. So we have used LT modifier. Next question is about, you can see There is a malfunction of vagus nerve on electrode array. The surgeon remove the array and pulse generator. So it's a removal procedure. Okay. So there is a malfunction. So now they are doing a removal procedure. So you just go by option. So easily you can conclude the answer. So under neurotrans, so you can see 64570, removal of cranial nerve, example vagus nerve. Okay, a neurostimulator, electrode array, and pulse generator. So removal of neurostimulator, electrode, and array or pulse generator. Okay, answer should be 64570. Option B is the answer. So again, I'm telling you, I am going by I'm choosing the correct answer. So you please navigate with all the option to cross check it. So next one is patient diagnosed with supratentorial intracerebellar hematoma. Okay, and the neurologist perform craniectomy to access the hematoma. The hematoma is accessed and using suction device, and it is used to remove it. Okay, what are the CPT code? So this procedure is regarding craniectomy or craniotomy. Okay, so let's see the answer. I'll be using more okay. Why? Because no, just with the live classes, I will be keep asking, is it okay? Is there any doubt? So same thing will come again in as I'm recording session through Google Meet. So it's like kind of, I hope you'll understand that. So yeah. So you can see this is again important, okay? So meninges, inflammation of meninges called meningitis. So that is also a repeated terminology question. And injection, drainage, aspiration, twist drill hole, and burr hole. Both are important. Okay, navigate all the codes and understand. So all of these things I'll be teaching in classes. Craniectomy or craniotomy. So you can see here, craniectomy or craniotomy, supratentorial and infratentorial. 61313 is intracerebellar. 61315 is intracerebellar. Okay, this is cerebral and this is cerebellar. Okay, cerebral or cerebellar, we have to check. So I forgot what they've done in our question. So yeah, intracerebral, they did intracerebral hematoma. So for intracerebral, 61313. 61313 is the answer. Okay, you can just see here. Evacuation of hematoma. They are doing craniectomy procedure to evacuate hematoma. The first standalone code says supratentorial, but the 61313 says intracerebellar location. So they are, doing or evacuating hematoma from intracerebellar. So that's why answer should be 61313. And next, a 45-year female had a closed fracture of L2 to L4 vertebrae, and for 15 years ago, now has a displacement on lumbar. Okay, that is 15 years ago, she had a closed fracture on L2 and L4 segment. Okay, between these two, not two, in these lumbar space, she had a fracture, and now she is suffering with a displacement of lumbar intervertebral disc between L3 and L4. So now the problem is in L3 and L4. The surgeon will decompress the spinal cord involving one segment of lumbar spine. One segment only they are going to decompress. Okay, you have to always check. Whenever they are talking about segment or interspace, check for how many segments they are decompressing or how many segment being removed. Okay, likewise you have to check, or how many interspace are there between the segments, that also you need to check. So one segment on lumbar spine, the surgeon performs surgery by going through pedicle on the disc bulge to reach the herniated disc. Lamina and facet joints are removed along with the disc fragments. Okay, so location is lumbar, since they have clearly said she has a problem on L3 and L4. Okay, so you have to see what is the correct answer for this. So between L3 and L4, you can see that they are talking about one segment decompressed. So we'll see the answer. So you can see 63056. So transpedicular approach with decompression of spinal cord, okay, on intravertebral disc, that is for herniated disc. So location is lumbar. And here 63056 cover single segment. Okay, if they have mentioned multiple segments have been decompressed, you would have also added an additional code 63057. It covers each additional segment. Okay, so check once again the question. The question they are saying involving one segment of lumbar spine. Okay, involving one segment. So the based on this documentation, your answer should be 63056. Okay, but if you get a clear documentation where two segments have been decompressed, then you can code 63056 and 6307. No, it is not 75. I think it is 57. Okay, so you can code 63056 and 63057 when if they clearly mention two segments being decompressed. But in our question, it is only a one segment. So hence your correct answer would be 63056. Okay, 63056 will be your correct answer. So next question. "47-year-old male recently injured as a passenger in car and accidentally sustained multiple fracture. Patient now has a physical restraints due to pulling out the Foley catheter and IV catheters and attempted to pull NG tube." Okay, so this is about injections. Okay, so let's see the codes. So this is, I said, this is an injection procedure. Okay, under that you have to check the first type of injections are paravertebral injection. Okay, paravertebral injections, here we have two separate code set. One is with a single injection, that means single level of injection. They'll directly inject on L3, L4 or L5 or maybe S1, S2. Likewise, one segment will be given. But here we are talking about in catheter. So indwelling catheter means, okay, that's a continuous catheter, continuous drug infusion will be there. So then, like, it's like catheter means it's like a soft kind of thing, so where it will reach all the multiple levels, not only a single level, it will reach to multiple levels. Okay, so now in the question they are talking about, they have used indwelling catheter, and what is the location they are saying? Location is into lumbar region. Okay, so lumbar region with fluoroscopy guidance. So guidance also they have utilized. So check this 62326 injection including indwelling catheter placement, continuous infusion. And 62326 says without image guidance, and 62327 says with image guidance that includes fluoroscopy and CT. Okay, so in our question they have utilized fluoroscopy guidance. So you can go ahead and select your answer as 62327. Answer is 62327. Okay, don't select option C or option A. Okay, these two are incorrect. By seeing that imaging guidance code additionally, don't go ahead and choose them. We have an instruction. So our CPT code 62327, it is already included with the guidance code. Okay, you don't have to code once again. So last code, two therapeutic injections are provided in single level at the intercostal nerve as a regional block for thoracic spinal nerve to relieve the pain of the patient with multiple ribs fractured. How this should be reported? So if you remember the trigger point injection coding guideline, okay, if you have studied musculoskeletal well, there is a concept called trigger point injection, right? In that, you will be aware the guideline. Don't focus on injections, focus on how many muscle being injected. Okay, same coding guideline will be applicable here also. So they are saying two therapeutic injections, okay, performed or provided in a single level at the intercostal nerve. So level is one only, but for that one level they have used two injections. Okay, by seeing two injections, you should not use an additional code. Okay, first I'll show the code description, then you will understand. You can see here. So units 2 they have given, and also one additional code they have given. So let's see the options. Zero, 2, 1. Okay, 2 says intracostal nerve single level, 644 says intercostal nerve each additional level. They'll 4420 and additional code 64421. Okay, multiple level means they should mention L1 to L2, L3 to L4. Okay, likewise. Then you will consider there are two level. Here it is a single level in our question. So for that, see single level on intercostal nerve. So for that, the answer should be 64420. You don't need to give any units or you don't have to give any additional code. So single code 64420 is the correct answer. This one. Because it says single level 64420. Okay. So yes. And these are the important questions. Okay. And also in classes, what I'll teach chemodenervination, SRS, strabismus surgery, and see epidural steroid injection and transforminal epidural steroid injection, paravertebral facet joint injection. Okay, so all of this will be discussed. Okay, the first one in our question, like which we were discussing, it is epidural steroid injection. The injection we have to check whether they have given single level or multiple level means using catheter. Okay, there are so many guidelines with every procedure that we need to learn thoroughly and we have to understand. So see here one more important question regarding strabismus surgery. So I hope everyone will be aware of strabismus surgery. I'll just explain. So in the strabismus surgery, you have to check where they are performing the surgery, like horizontal muscle or vertical muscle. That you need to check. Okay. And after that, we have to check any additional procedure being utilized or not. So in our question, physician resects the medial rectus horizontal and lateral rectus muscle. So two horizontal muscle being used here. Okay, so for two horizontal muscle, what will be the code? We will check. So you can see here, extraocular muscle, strabismus surgery 67311, strabismus surgery, recession or resection, one horizontal muscle. Same way for two horizontal muscle, code is 67312. And if they perform on vertical muscle, one vertical muscle code is 67314, two or more vertical muscle code is 67316. Okay, you can see the note for adjustable sutures, use these codes. I mean, there are multiple additional procedure can be used along with the strabismus surgery. So we have checked okay, or lateral, and vertical is inferior or superior rectus muscle. We will consider as a vertical muscle. Okay, both procedure related to eye. Strabismus surgery means correcting of misalignment of eyelid. Okay, so question is, so I said two horizontal muscle. So two horizontal muscle means code should be 67312. With that, you can see what is the extra procedure they have did. Secure them with the adjustable sutures. So adjustable suture is an additional procedure. For that also you have to code. 67312 is the correct code for two horizontal muscle, and check what is 67335. So here are the additional procedure can be performed with the strabismus surgery. So 67335 says placement of adjustable sutures. Okay, and 67334 says strabismus surgery of posterior fixation. 67332 says it's a scarring of extraocular muscle. So in our question, the additional procedure is placement of adjustable sutures. Okay, so the correct answer should be 6C, 67312 with 67335. Okay, so yes, that's it, I think. So these are the important questions for few important questions for nervous system. Okay, please go through, and please do subscribe to my channel, and please do share with your medical coding friends. Okay, so many of you have commented very nice feedback on my classes, I mean the YouTube sessions. I'm really glad, and if you are liking it, please do share it with someone who also needs or who also is like preparing for any kind of you know CPC or medical coding interview. In my channel, no, you will get everything. It's like both professional industry insights and the beginner kind of information, and also for CPC oriented classes. Okay, and like if you are from USA and you are watching my video, so you will be having doubt like how I am offering the classes. So many queries will be like, I want to join for CPC preparation live classes, but I'll tell you the difference between basic to advanced class and CPC preparation class. Okay, CPC preparation classes are for those who have completed training. Okay, and like they might not have enough confidence to write exam, or maybe they have completed training in the last year or 2 year back, and they need a refreshment. Okay, and also the people who got failed, those can join the preparation classes. Okay, it is completely CPT based classes. Okay, ICD will not be there because ICD is again 20 more days we need to discuss that. So CPT will take some 20 to 30 days. It will be over. So since we will get some 65 to 70% marks from the CPT, I'll focus on that more into CPT, and remaining additional modifier, billing and compliance, HCPCS, anatomy, terminology, everything I'll give you with the important material, and also class recording. If you want to learn modifier and the basic billing and compliance, HCPCS, modifier, everything, if you need, you can ask me the recording. I will provide that. Okay, but in live classes, I'll be covering all the CPT chapter, including surgical and non-surgical, everything. Okay, so coming to basic to advanced, here it goes like 45 to 60 days. So it is like it starts with a basic, and then coming to advanced level, like learning the actual CPT concept and practice questions, and covering all the chapter coding, ICD coding guidelines, also HCPCs and other fundamentals. So here also again complete CPC syllabus will be covered. Okay, so based on your wish, you can join the class. And if you are calling me, definitely I may not give response to you, because it is not like it's a business number, and it will be there in my Instagram also, and many queries will be like for everyone I really can't respond. Like few will be actual students and few will be not, so I don't want to get some kind of disturbance. So I will go with the WhatsApp. So if you are looking for classes, please write me a clear message saying that you need this and you have suffered this kind of these things. Like you might have had a challenge to pass, or you might have forgot few concept. Likewise, what is your thing? You can write me so that I'll get back to you. Okay, sooner or later. So that's all, guys, for today. So thank you for watching. If you're still here, I'm very glad. Please do subscribe, and please do share with your medical coding friends. Maybe day after tomorrow, I'll try to cover radiology section as well. Thank you all.